Come in.
Hey there. I'm Dr. Dr. Hayden. It's nice to meet you. I just want to verify your name and date of birth real quick. Perfect. You're just the guy I'm looking for. So we're going to talk to you about some recent, epilepsy, some seizure episodes that you had. It's going to be a lot of information, so I actually printed out some info for you. Just hang on to that. We're going to go through it and try and figure out, based on last week's assessment and then today's assessment, try and figure out some care plans moving forward for you, okay? And then these are your nurses here. This is Hannah. And this is Sydney. So there's some information for them as well. This is your chart. This is all info we had from last week and whatnot. So just gonna take a seat here. Seems like you've found yourself diagnosed with epilepsy. But I know it might be pretty traumatic, pretty stressful, but you're not alone. This affects more than 2 million people in America. It's one of the most common chronic neurological conditions.
How do you know that I have epilepsy?
So, yeah, that's a good question. So you came in last week. We did, your nurses did a full head-to-toe assessment. On top of that, as your neurologist, determined you had epilepsy and determined what type based on CT, MRI, electroencephalography, and some other labs and stuff that all kind of concluded that you had epilepsy.
I don't understand. I need you to break this up for me. I thought I was just having seizures. What is epilepsy?
Sure. So epilepsy is just chronic seizures. They happen fairly regularly. It's kind of hard to diagnose. That's why we do so many labs and tests and stuff like that. The actual definition of it is paroxysmal disease characterized by altered or loss of consciousness, involuntary muscle movements, and sensory disturbances. Basically, you're having abnormal electrical discharges and your brain is misfiring, and you have all these little pathways in your brain and your body that are just going all haywire because your brain is sending in mixed signals.
I did so many tests last week. What did you mean when you said a head-to-toe assessment?
Yeah, head-to-toe assessment. It's pretty good. So it starts off with a general survey, just like kind of what you look like, the Glasgow Coma Scale, so how well you're able to answer our questions and how alert you are, basically. Then health history, we get all of your past diagnoses and medical traumas and stuff like that. And then integumentary assessment, we just assess your skin, wounds, anything like that, bumps, bruises. Assess your 12 cranial nerves, make sure everything is functioning properly, all your muscles are moving equal bilaterally, and that's what the musculoskeletal thing is. So when I was touching all your toes and pushing and pulling on your hands and feet, kind of making sure they all pull and push the same. And then of course, your vital signs last week and then this week too. So basically just, general sensory, motor, reflex and balance evaluations, and that's about it.
So I know you had a seizure this morning, and during that head-to-toe assessment that you had with the doctor, you really focused on the neurological aspect, and so today I'm going to ask some more specific questions, focus on that neurological aspect and specific to the seizures that you had this morning. Okay, is it okay if I ask you a couple questions about that?
Of course.
Okay.
Before you guys get started, I'm actually going to get out of here, but it's nice meeting you. Your nurses will take very good care of you, and that being said, I'll see you next time, okay?
Thanks, Doc.
But you did say that you're kind of, that you pass out quite a bit, or you lose consciousness. So you told me that your wife has some of the information that we might need. So I'm going to ask, do you have any warning signs before your seizures start? Do you have, it's called an aura. It can be visual, auditory, or motor. Do you see any lights, hear any noises, have any muscle movements, or anything prior to a seizure that's warning you that you might have a seizure?
My eyes start to twitch, and I would say I do see some lights.
Okay.
And sometimes my muscles get very weak.
Okay. I was looking over your chart. Do you know where your seizures begin?
I would say probably around this time last year.
Okay. Okay. And then I'm going to ask you specific questions about your seizures, and you said you are often unconscious. So is there someone here who can, or is there anyone who witnesses your seizures?
Yes, I brought my lovely wife.
Okay, great.
Yes. Hello. Do you mind if I squeeze in here next to him?
Please.
Oh, thank you. Thank you.
So in this focused neurological assessment, I'm just asking about seizure activity. So do you notice any color changes in his face or lips?
He does get a little bit pale, yeah.
Okay. And then do you notice any eye fluttering, eye rolling, lip smacking?
There's a lot of eye rolling,
Oh,
if you know what I'm saying, but no.
okay. And any incontinence?
This seizure was a little bit worse this morning, and he did tinkle a little bit, but besides that, normally no.
Okay. And James, do you experience any headaches or muscle weakness following the seizure?
I would say I usually get a pretty bad headache
Okay.
soon after.
And how long was he unconscious after
I
or
think it was-
during the seizure?
During the seizure, I think he was shaking for about 30 seconds.
Okay. And there can be some precipitating factors, so things that bring on the seizure or make you more likely to have a seizure, and those can be certain activities, fatigue, stress, medication. Do you know if there is anything in particular that tends to bring on his seizures?
Nothing out of the normal. I mean, he does drink a little bit of alcohol, and he goes to a lot of those bright, flashy light dance music
Oh.
festivals.
We will definitely make note of that. And also, anything that you do to alleviate the symptoms after it's happened. I know you said you get muscle weakness. Anything you do to help with that?
Yeah, afterwards I typically just turn the lights down a little bit because he gets a headache, and give him a nice little massage all over his back and his legs and his little booty.
And also, we just have a couple terms that I wanted to go over with you, because seizures can have motor symptoms, non-motor symptoms, or both. So I have this list of terms, and I'm wondering if you can, as you read that, clonic, atonic, tonic, myoclonus, epileptic, spasms, absent seizures. Do any of these sound?
Definitely most of his seizures are clonic and tonic, I would say. He's very tense and he jerks a lot. And even when he's not having seizures, it seems that he is absent with me.
So oftentimes there can be motionless staring spells, and those are actually, those can be seizures. He may not be aware that he's having a seizure, so if you will make note of that in your journal,
Yeah,
that would be wonderful. And
I thought you just weren't listening to me.
I always listen.
so these are very common motor and non-motor symptoms. And then just thank you, Nurse Sydney. I think that's all the questions I had about your specific seizure. We talked about precipitating factors and relieving factors, lifestyle questions. You mentioned drinking and lights. Just want to let you know that there is we want to monitor after the seizure. There's about a normal 5 to 30 minutes of altered state of mind. That's why we go over that Glasgow Coma Scale. I'm going to give you that information so you can assess his level of consciousness. That period, his mind may not be all the way there. So we want to make sure after seizure also that you're putting him on his left side. Never put anything in his mouth.
Okay, that's really good to know because I put a spoon in his mouth to try and make sure he didn't swallow his tongue.
Yeah.
Okay.
Okay. And then I know you were asking earlier what's causing your seizures. You asked in your paperwork, that was one of your questions. So I just want to let you know that 50 to 70% of people don't have an identifiable cause of epilepsy or of their epilepsy. So common causes can include genetic influences. We can have head trauma from car crashes, medical disorders, but you have no history of dementia, seizures, dementia, strokes, or heart attacks yourself or your family. There could be prenatal injury if your mother had any infections, or if there's any developmental disorders like autism in your family, or personal, or between you or your family, or if there's a history of Down syndrome. But again, it's most likely that you're within this 50 to 70 category or range of people with unidentifiable causes.
So what are some symptoms of epilepsy that my spouse and I can monitor?
That's going to be that aura that you talked about, that change in color. You said you had some muscle weakness, and you said eye twitching. So that is something that you can monitor for, and then you continuing to monitor those signs and symptoms we talked about, writing those down,
Perfect.
time of day when it comes, anything that's bringing them on, relieving them, that's very important for us.
Absolutely.
Okay,
Will do.
great.
I understand I'm having seizures, but are all seizures the same?
No, so there are actually 3 different types of seizures. You got the generalized, the focal, and then just unknown. So that is kind of our responsibility in finding out if you're more generalized or the focal. But with generalized, kind of affects all parts of the brain. With the focal, it affects one side. So if it is affecting one side, you'll have symptoms all about the other side. So if you're having some seizure symptoms all about your right side, that's where we diagnose the focal. With the unknown, usually we kind of just will eventually diagnose you with the generalized or the focal.
How does epilepsy affect my body?
So, how it affects your body is it can be neurological as well as musculoskeletal. It just kind of depends on the type of the seizure as well as the length of the seizure, and we'll get some more information as time goes on. We get some more information from you. So with generalized, you got that loss of consciousness, some involuntary muscle contractions, and then with the focal, you got some spasms of the muscle groups and a lack of awareness. And with those, you also want to kind of watch when you have your seizures if you're having any bruises or skin injuries or anything like that, because it is important to just do a quick body assessment after you have a seizure to make sure that you did not harm yourself. And then I wanted to kind of move on to some patient education. So I do have a resource here that I will give to you.
I'll take
And
that.
you can add that as well. With that resource, it just kind of talks about how some drinking, alcohol use, and smoking affects your seizures.
You hear that?
Yes. So it is important to kind of limit to not drink any alcohol, otherwise it does prohibit your seizures, as well as tobacco use. And then with your rest, it is important that you get plenty of sleep. Sleep will help. And then if we do prescribe any medications, just make sure that you are taking them as prescribed, good dosing, that kind of thing. I do have some support groups in there. It's for the epilepsyorgan.org. They got some good resources. If you have any further questions, you can look at that. As well as they have support groups. They can do virtual and in-person appointments. So if you are wanting to just kind of get some more information and find someone that understands kind of your disease, you can do that as well.
It's
And
so good
then-
we're getting help for you.
Yes. And then developing a seizure action plan, so having good family support, just making sure that you're in a safe environment when you have a seizure. And then your aura, which we kind of talked about earlier, which is just that unique sensation you get before you have a seizure, is important to kind of just distinguish. Everyone's sensation can be different, but distinguishing that, making sure you sit down, you're in a safe place so you don't cause any bodily harm is important with your seizures, as well as getting some support. And then healthy diet and exercise, reducing, managing your stress is also very important. And then that is all the information I have for you. If you have any questions, let me know, but that resource is very beneficial.
Thank you. I appreciate it.
Yeah, thank you so much.
We'll get out of your hair. I know the doctor had a couple other things that he wanted to say. But thank you so much for your time.
Thank you.
Yes.
I'm gonna leave you alone with the doctor, okay, honey?
All right, thank you.
I'll be right back in.
I'll be back to pick you up in a second.
Sounds good.
Hey.
Hey, doctor,
Hey.
how you doing?
Good, good. Glad to see you. So, I know you didn't have any questions. Actually, chair's a little far away. I'm just gonna sit over here.
All right.
These are questions for you, as well as anyone else who's curious about epilepsy. And they're actually NCLEX questions. So first of all, we have a knowledge-based question. Which of the following procedures should be included in diagnostic testing of an individual with suspected seizures? Electroencephalography. B, angiography. C, transcranial Doppler ultrasound. Or D, myelography. That is correct, it's A, electroencephalography. This diagnostic procedure monitors brain activity through the skull and can be used to diagnose seizure disorders and epilepsy. The second question we have for you is an application-based question. So, Hannah, a 21-year-old female, complains of an exacerbation of her epilepsy compared to a few months ago. You gather the information that she takes levetiracetam and oral contraceptives. You then provide education and health promotion to help reduce her risk of having seizures moving forward. Which of the following statements indicates a need for further teaching? A, my oral birth control does not increase my risk for seizures. B, it is important to get plenty of sleep. C, I do not drink more than 2 alcoholic beverages when I go out with my friends. Or D, I drink plenty of water, especially when it's hot out. That is correct, it's C. I do not drink more than 2 alcoholic beverages when I go out with my friends. Hannah should be educated that she should refrain from drinking any alcohol, as it is a major predisposing factor for epilepsy and single seizures.